Hello students, welcome to Pathology PYQ series. Today's important topic is thrombosis and embolism. Generally, a differentiating question can be asked or any topic can be given. So let's see the introduction. See, thrombosis and embolism are important hemodynamic disorders leading to vascular obstruction and tissue ischemia. Tissue ischemia, you understand that tissue is being cut off, there's a curfew, uh, lack of oxygen, lack of nutrients. Okay, and they are the common causes of infection and sudden death. So, what is the definition you need to write in an exam? See, thrombosis is the formation of a solid mass from blood constituents within the vascular system during life. Okay, whereas embolism is the obstruction of a blood vessel by a detached intravascular mass carried by blood from its site of an origin. Thrombosis is simply, you might have seen a road. I'll give you a very crude example. You are seeing a road and a tree starts growing from the inside but on the road. But when the tree plant is small it will not create a problem, but when it will become a tree, any accident can take place. Whereas embolism in simply means that there is a drainage going on and suddenly a brick comes and gets fixed in the drainage. So what will happen? There would be an obstruction in the flow. This is embolism, because sometimes in the exam pressure students get confused. So having these bare bone examples will let you recall fast. What is the etiology of thrombosis? Virchow's triad. This is the most important part which you need to do. Virchow's triad was simply given by Rodolphe Virchow, who said that any patient having all these three factors has a high tendency for deep vein thrombosis. So first is endothelial injury, which can be atherosclerosis or due to hypertension. Uh, our endothelium is generally very smooth. Nothing sticks. Everything keeps flowing. But when there is an injury, there comes space where anything new can get stuck. Anything can stop the circulation. What causes endothelial injury? Atherosclerosis or hypertension. Second is abnormal blood flow. Abnormal blood flow, our blood is used to going in a certain viscosity, certain speed. Whenever there is a stasis or turbulence, stasis simply means that blood has been stuck for very long. Like in the case of sedentary persons who keep sitting for 10-12 hours a day, they have high chances. Okay, so it is always advised to do improve your movements. Turbulence simply means that the blood flow is irregulated high. Third is hypercoagulability. Hypercoagulability is mainly either inherited, factor 5 leading, which simply means genetic, or it can be acquired either by after pregnancy or malignancy. So, for if in any patient all these three are present, uh, let's say we'll take a woman who was recently pregnant, she delivered her child. First risk. Second is she works at a desk job for 10-12 hours, or she's taking bed rest, she's on in her bed and there is very less movement. So here there is abnormal blood flow. And third would be she has so much stress that she has hypertension. Okay, hypertension we know is 90% due to environmental factors. So these three make up higher, very high chance for infection. And that is why you see we are seeing so much MI cases, even in the case of young persons who are very ambitious. Today we have the hustle culture. Everybody is working 10-12 hours. They keep sitting in front of the desk, in front of the computer, doing their work. They don't have time to exercise. They sleep less. So this abnormal blood flow is plays a very important role in that. Types of thrombi: arterial thrombi, venous thrombi, pleural thrombi. We'll again spend some time here. Arterial thrombi would generally be found where there is an area of rapid blood flow and it is triggered by endothelial injury. Why it is called a white thrombi? Because generally platelets are and fibrin is involved, so they have a pale look. Whereas in the case of venous thrombi, which is rich in fibrin and RBC. Why? Because it happens at a slow moving area, and clot has the since it is slow, clot is able to trap a large number of RBCs. So we get a red thrombus. Neurothrombus is simply attached to heart walls or large vessels. What is the fate of thrombus? Whenever if a question comes in SAQ, always write the phrase of thrombus. There can be four things. First is propagation. It can improve. Second is embolization. Embolization simply means that it can detach the plate. Anything that has been stuck can be detached and move in our circulation, causing infraction. Third is resolution, generally by medicines. There are many medicines given to dissolve. And fourth is organization and recanalization. What are the types of embolism? Thromboembolism, you have understood the thrombus breaks. And second is fat embolism, fatty acids. Sometimes when there is ischemia, can break down and act as a. Third is air embolism. Air embolism simply means air bubbles can get stuck. And fourth is amniotic fluid embolism. And last, septic embolism. What you will find in pulmonary embolism, that it usually arises from DVT, deep vein thrombosis of lower limb. Small emboli may be silent, large emboli may cause sudden death, medium emboli may cause pulmonary infraction. What are the complications? You will get infraction, gangrene, sudden death. Exam quick points. You have to remember Virchow's triad is the key concept in thrombosis. And if a SAQ comes, write all these three headings: abnormal blood flow, hypercoagulability, okay, and endothelial injury, and explain to it properly. There are some things which are very important, and this is one of these topics. See you in the next topic. Thank you.